I want to talk to you about the opioid endemic that is happening across America and that is only getting worse. The opioid endemic in the United States has impacted over 10.3 million people above the age of 12 in 2018 and is constantly rising. More than 130 people die every day from an opioid overdose in 2017. How can we solve this problem? How can we reduce the number of overdoses that occur every day in communities throughout our country? That is what I will be explaining to you in this video, as well as what you guys can do to help. For those of you that don't know, opioids are drugs that replicate the pain-relieving and euphoric feelings that people crave. Some examples are morphine, oxycodone, hydrocodone, Percocet, and even heroin. A doctor from the New York University Hospital estimated that 81% of users get their painkillers from a physician, whether directly or from a friend who got them prescribed. These drugs are very deadly at a high dose and of course extremely addictive, which leads to many overdoses. The most effective way to combat the many overdoses across our nation is to implement safe injection facilities. I know what you are thinking. Why should I care about random addicts overdosing on opioids? It doesn't affect me. Actually, it does. The opioid crisis needs to be understood as a public health issue, not a personal issue. The impacts addicts have on their community are plentiful. Some examples include increased crime in the streets, driving under the influence, costs to keep them in jail, and even their unemployment costs everybody money. The International Narcotics Board put out a statistic that unemployed drug addicts cost the United States $120 billion in 2011, and the taxes we pay to keep addicts in jail adds to that cost. We need to make sure we look at the big picture when it comes to the impacts drug addicts have on their communities. We can limit the amount of unsafe drug use and even save money in the long run. Now, let me explain what a safe injection facility would really do. At these healthcare professional flooded facilities, there would be sterile needles, long-term treatment, and even access to anti-overdose treatment. This would, in general, limit the number of overdoses in the community, which in turn would help combat the safety issues as well. Drug users would be able to voluntarily enter these facilities and safely use the drugs they provide with supervision of trained professionals that can administer anti-overdose treatment if necessary and provide guidance toward long-term treatment. The truth is, many addicts are embarrassed to use in public for various reasons. These facilities would increase their feeling of respect and safety, which are the first steps to a full recovery down the road. They would further decrease the risk of infections and transmittal of HIV and hepatitis throughout the community from the use of clean needles. A real-life example of these in place comes from Switzerland. They experienced a heroin overdose epidemic that killed millions of people. Their response? Safe injection facilities. With these in place, after 15 years, 0 people have died from heroin overdoses. Around the world, these injection facilities are gaining traction. There are about 100 facilities outside the United States, mostly in Europe and Canada, that are noticeably decreasing the amount of deaths in their communities. These facilities won't just help with heroin users, they will also be available for pain reliever drug addicts including Percocets, oxycodone, and even morphine. There is an increased danger with these pills because recently they have been found to be laced with another synthetic opioid, fentanyl. Fentanyl is one of the most potent opiate-based painkillers that is mainly used for surgeries. Its effects are much more effective at low doses when compared to other opiates, so some drug dealers lace their painkillers with fentanyl so the addicts will come back. It is up to 100 times stronger than morphine. The addicts are unaware that it is laced with fentanyl most times, which results in accidental overdoses. With these safe injection facilities, if someone comes in with laced drugs, they can be treated immediately for a potential overdose. There are concerns among many people that these would cost a huge amount of money to create and implement in society. However, according to 2 professors from Harvard, there are opioid-specific project grants from entities like the Substance Abuse and Mental Health Services Administration and the CDC. And, in the long run, research from a nonprofit research group found that a 13-booth facility would lead to $3.5 million in net annual savings for the city alone from averted HIV infections, reduced skin infections, averted overdose deaths, and medication treatment uptake. If these end up making the city money, wouldn't you want them to go in place? The extra money could go to making the streets safer and for a variety of other things as well. There are very few negatives to these safe injection facilities. In fact, there are many positives. Take a look at these results from injection facilities in Canada. Over 400 drug users have entered detox programs with over 42,000 referrals to other services. 14,572 patients enrolled in methadone maintenance programs, 55% decrease in reported cases of hepatitis C, and 78% decrease in reported cases of HIV, and 76% of British Columbians support these facilities. The Drug Policy Alliance is a coalition that understands a person should not be punished for what is put inside their body, but for the crimes they commit that impact others. They support safe injection facilities, or how they call them, supervised consumption services. The DPA is an amazing organization with useful information about the war on drugs in the United States. They know that punishing the user is not going to end this opioid crisis we are going through. They believe that we need to help the addicts in a productive way that helps the community in the long run. Visit them at drugpolicy.org/SCS to get more information about the facilities and impacts they will have on your community. Now, what can you do? The most impactful thing you can do is spread the word on how to solve the opioid endemic. Safe injection facilities will save thousands of people's lives every day, so why not implement them? Another thing you can do to get these facilities put in place in your community is to contact your state senator and tell them to embrace a health-based solution to this nationwide crisis. Go to this website and click on Contact Your Senator, where you type in your information and they send a clear message to your local senator. Please, something other than violence must be done to combat the increasing overdoses due to opioids. Thank you.